The constraints we face in daily life due to COVID-19 can cause a lot of frustration. But as the pandemic stretches on with no end in sight, impacting our health, jobs, income and even relationships, the stress of it all is becoming too much to bear. And this has led to a rise in mental health issues all around the world, while access to help and treatment have been largely compromised as medical institutions are overwhelmed with COVID-19 patients. Experts are warning that this may generate an unprecedented mental health crisis amid the pandemic. The World Health Organization, in fact, says mental health needs must be treated as a core element of society's response and recovery from the pandemic. So on how we should address mental health issues over the course of the COVID-19 pandemic on an individual and societal level, we connect with Raymond Abdulrahman, Director of Clinic Psychology Manitoba and President of Lead with Diversity. He's joining us today from Winnipeg, Canada. It's great to see you. Thank you so much for joining the programme.
Thanks for having me on.
Right, well, so we hear that we're seeing a rise in mental health issues all around the world, and really, how is the coronavirus, affecting the response or treatment of those who are struggling with pre-existing mental health conditions?
Well, generally speaking, access to mental health treatment and services is poor across the world. Even in the United States and Canada, we do not have enough access to treatment. So we're already at a disadvantage. There's already a shortage of access to care. Now, in the middle of this pandemic, not only is our physical health impacted, but also is our mental health. And our health systems are generally not prepared to meet the needs of the mental health crisis. Rates of mental health generally are globally at minimum 1 in 5 individual. And that meets a diagnosable disorder. In the face of trauma or difficulty, rates can double, can quadruple, and sometimes be much higher. And so we can expect that we are sincerely underwhelmed in being able to prepare to deal with the mental health crisis tied to COVID.
And those of us dealing with stress or mental health issues, support from family, friends and loved ones is so important. But then during this pandemic, more and more of us are having to we're really having to distance ourselves from our family and friends. And well, how is that affecting people with anxiety and obsessive compulsive disorder, especially?
Right. So generally speaking, living our everyday routine lives, going to work, connecting with family, having those social supports, those are all generally psychologically healthy things, and they can actually keep our mental health in balance. And when people come in for treatment, ultimately our goal is to help them move back to those everyday routines, because that helps sustain good mental health. And those are now gone. And so those will generally impact our overall ability to cope. And so rates of mental health and depression or anxiety and depression are generally going to be higher. But more specifically, the COVID pandemic has lost a sense of control. We've removed that sense of control that most people have. And when we remove that sense of control, rates of anxiety are generally significantly higher. And so what we're finding is rates of anxiety or anxiety disorders, and in particular, things tied to obsessive compulsive disorder, where people are concerned or will engage in more compulsive behavior, is actually going to get significantly worse. And so what would typically have not been more healthy behaviors when it came to mental health, the excessive cleaning is now the norm. And it becomes very difficult to differentiate between what would be a healthy behavior when it's tied to OCD and an unhealthy one, which might be excessive cleaning or ritual cleaning.
Then what can people with anxiety or OCD really do then during this pandemic to make sure that their worries don't get too excessive?
Well, there's several things people can do. Number one is actually they minimize access to the news. Sometimes excessive coverage can actually flare up anxiety. Set a time in your day or in your week where you might touch base to just get the updates rather than being obsessively consumed by it. That would be step number one. Step number two, pay attention to your local restrictions and recommendations by public health experts. When we start, because the second wave of the pandemic is coming about and it's going to be different across the world, pay attention to your local community and what the restrictions and recommendations are there. And number three, pay attention to and apply those recommendations for your region versus elsewhere. One of the other very important things is to be able to create a sense of routine. So it might not be what we're typically used to, but having a new routine, something that we can start to do on a regular basis, would be very helpful. And one of the last, and well, second last important things would be ensure that we find a way to stay as connected as possible to people. So once we approach, where we are going to be getting back to quarantine, finding other ways to connect with people, even if that's electronically. And the last and most important thing for people to consider is to be very mindful about coping inefficiently. So many times people will turn to substances or poor, unhealthy behaviors that will help them cope with the illness, and that will actually make mental health matters worse.
Well, those of people with pre-existing mental health issues know to look out for certain signs that that we may be crossing the line, or that our mental health may be deteriorating. But what about those without a diagnosis? I mean, which social groups respond strongly to the stress of a crisis like the COVID-19 pandemic?
Well, the short answer is all of us. And I think what COVID proves to us is that we're all susceptible to mental health. Those initial rates that I pointed out to you that said approximately 1 in 5 individuals would meet the criteria for a mental health diagnosis, that's at any given year. If we start to look at rates of mental illness over the course of a lifespan, we find the rates to be significantly higher. 85 to 90% of the general human population will struggle with some sort of mental illness at some point in time in their life. And so I would say that all of us are susceptible, with the right conditions, with a certain level of stress, and something like this pandemic can certainly stress out all of us. We're all susceptible to mental health illness.
What about some social groups that might be particularly vulnerable, like those who are losing their jobs, or even minority groups?
Yes, absolutely. So there will always be certain disadvantaged groups. You're going to find people who are individuals who are forced to work, because of a lower socioeconomic status. Sometimes that's tied to ethnic or racial groups. They're going to be more susceptible. We're also going to find greater difficulties, individuals who are susceptible to substance use or alcoholism, and individuals who are in abusive or difficult relationships. We're finding rates of domestic abuse, childhood abuse. Those tend to be significantly higher. And so whereas work and a general routine generally protected those individuals because they had to go out, they no longer have those protections.
Right, and you just briefly mentioned the abuse cases that may happen in the family or the household, and we have heard that these abuse cases are increasing, whether it's substance abuse or domestic abuse. So how does stress really then trigger such outbursts?
Sorry, could you repeat that question?
Oh, so how does stress trigger such outbursts of abuse, whether it's substance abuse or domestic abuse in the home?
Well, most of the time people are engaging in substance abuse or engaging in unhealthy coping. But when we talk about substance abuse, they're engaging in it as a form of self-medication. And without the actual tools or the systems in place like everyday work or what we would call behavioral activation, the social supports, when those aren't there, people will turn to self-medicate. In terms of domestic abuse, where this might be tied to personality or people's inability to manage anger, what's happening is simply being at home just presents them with an increased opportunity to engage in abusive behavior to the people that they're around.
Right, and as you said, there needs to be greater social support for this, but do you think there is an adequate medical response to mental health right now? Some people are saying that, some experts are saying that it could lead to a worldwide mental health crisis. I mean, would you agree with that?
Absolutely. There is not enough response to this, even in the way that we've actually been responding. The public health news that we've been talking about, the way the news is delivered is not really in a way that is effective to engage behavioral engagement. I think for many people, we have two kinds of responses when it comes to the restrictions and social distancing. We have people who become increasingly anxious, and we have people who are completely complacent and they don't abide by those rules. And in both cases, we're dealing with a really dangerous situation. So even when it comes to delivering the restrictions and recommendations of public health guidelines, the way those are delivered need to be more specific, need to be more calculated, and need to be more calm. Because we have to remember that the leaders, and in this case, the public health experts, are the ones who are setting the trend in how we respond to this crisis.
And really, how should they respond then? How should the support system really change in light of the pandemic?
Well, I think number one, it needs to be very specific. There's several times in our region where news about the pandemic that's been given, like rates of the actual COVID virus, are reported generally, instead of very specifically, and that can become quite alarmist. The recommendations need to be very specific and very clear. Sometimes it's better to err on the side of caution instead of leaving free will to some of those individuals to say, you can make your own judgment. In a case like this, it's better to be more careful than to be less careful. And many times, of course, we want to opt to offer people choices. But in this kind of case, we need to be very clear about what the outcomes of this virus are going to be. And sometimes that's not been the case.
And well, obviously for most of us, we do fear, worry and stress about things. And those are, of course, very normal responses when crises like the COVID-19 pandemic hit. But how can you tell when you are not properly coping with the stress? And what should we do then to seek help?
Well, generally speaking, we would say anytime a mental health difficulty or some difficult emotions are interfering with your ability to live your everyday life, that is a sign that you need to get help. The difficulty in this circumstance is that the COVID pandemic is preventing all of us from living a regular life. And so I would say that most of us could benefit from some good mental health interventions. Now, one of the things that a public health intervention can do would be to think about a stepped care program, where there are programs on television or ways that we might disseminate good public health information to the general public. Tips and or programs like this, where we're actually talking about mental health, can be very effective. But then the mental health system, or the health system, actually needs to start to focus on finding ways to access professional help, where individuals are trained to identify a problem and deliver a problem. One of the things to pay attention to is that we're not engaging, with our work as much. So many people will now be working from home, and they may find it's harder to get out of bed. They might find their diet is susceptible or impacted. They have an inability to engage socially. They might have difficulties with libido. Now, when I'm saying this, most of us are probably nodding our heads. And that would again suggest that most of us can be impacted by this, particularly at times when we were in higher levels of quarantine. So if you're struggling, start to be able to ask for help. I would say we can never be too early to ask for help in this particular circumstance. When we have the benefit of work, we have the luxury to see how much a mental health problem is interfering with our lives. In this circumstance, we don't.
Right, I completely agree. Rather than ignoring it or trying to stay strong, it's always better to ask for help when we need it. And well, then how can we support people around us, friends, families, neighbours and loved ones? I mean, how do we really pick up on the signs that they're feeling unwell?
That's a really good question. Most of us will know individuals very well that we can tell when people are not doing well. And I would say, in many cultures, we might feel it as an imposition to ask about people's mental health, and so we stay at a distance. And I would say, pass that barrier. Don't worry about being inappropriate, and ask about ask people how they are doing. One of the best things we can do is make sure that we're in touch with people, even if it's by phone, as much as possible. People might typically consider that an intrusion, not in this case. For people who aren't doing well, just having a social support. You may not be offering an active solution, but if you're offering an ear or some friendly support, that can do a lot when it comes to preventing severe mental illness. So I would start with that.
Well, I'm afraid we're going to have to let you go now, but thank you so much for joining the programme. That was Raman Abdul-Rahman, Director of Clinic Psychology Manitoba and President of Lead with Diversity. Again, thank you so much for joining us and for your incredible insights.
Thank you very much.
And to our viewers, thank you for watching. We'll be back at the same time tomorrow with more global insights on issues making headlines. Have a lovely day or evening wherever you are. Goodbye.